Hey guys, it's Greg Downing, your favorite Medicare agent, coming to you live from beautiful Liberty Hill, Texas. And today we're talking about the 2025 annual enrollment period. It is going to be very interesting, and you need to be ready to shop and compare your plans because I'm here to tell you there is a tremendous amount of disruption with the Medicare Part D. That's the drug plans in 2025. What's happened is with the Harris-Biden or Biden-Harris administration, that's kind of funny, could be either way, but their new regulation and changes with the Part Prescription D plan are going to make a tremendous change in 2025. Now, here's the key points of what you need to know. One, there's a few folks that will really benefit from the changes in the new law. But most people are just going to see a higher drug premium. Their drug plans are going to go up. We're going to have fewer plans to choose from. Medicare Advantage plans will have to reduce their benefits because of this. And many insurance companies are no longer paying insurance agents to help people roll in prescription drug plans. And the result of that is fewer agents will be selling prescription drug plans during the annual enrollment period. And unfortunately, I will be one of those people. Now, as you watch this, you'll have a better understanding of why I'm choosing to do this. And that doesn't mean I'm not going to help you. I'm going to just have to help you in a different way because of the unintended effects of this new changes for 2025. So what I'm going to do is I'm going to tell you the good and the bad and the ugly of the whole thing. And so basically, this is all under the Inflation Reduction Act of 2022. Now, if you're like me and most people, we think that this legislation has mainly to do with inflation, but this is not the case. So this is from Wikipedia. It says the Inflation Reduction Act of 2022 is a United States federal law which aims to reduce the federal government's budget deficit, lower prescription drug costs, and invest in domestic energy production while promoting clean energy. And you'll notice there's not anything in there regarding inflation. So this is very typical with administrations. They'll use a crisis like the inflation to pass a bill that has a lot of things in it that normally wouldn't be able to get passed on their own because they don't have enough merits. It's not been actually vetted. So we have a lot of these things that happen, and then we have a lot of unintended consequences that they didn't think through. So anyway, that's where we are. This is all because of this. Now, this started in 2023, and there are a lot of good things about the improvement to the prescription drug plan. Like in 2023, what happens is they limited the cost of insulin copays to $35, and that's cool. That's good. I like that. And they also started to cover adult vaccines at 100%. And the key one to be was the single shots, because I can't tell you how many people yelled at me because they had to pay $400 or $500 for their shingle shots because everybody had to meet their deductible before they would pay for it. So going forward and today, you don't have to do that anymore. Now, and again, there's lots of things in here. I'm just hitting on the high points of what's all in the bill. Now, this year, the key things that I think were good, they expanded the low-income subsidy. You can make up to 150% of the poverty level, and that helps people with lower income pay for their drug cost. I think that's a good thing. Also, 2024 is the last year of the donut hole. Now, if you don't know what the donut hole is, that's good. Hope you'll never have to learn about it again, but for those of you who do, know the donut hole, also known as the gap coverage. That is basically what happens is when you have expensive medications and all of a sudden you look up one month and your premiums have doubled or your copays have doubled on your prescriptions. And that's going away, which is a good thing because they're very difficult to explain, these prescription drug plans, if people have a lot of expensive medications. And this year, There is no 5% if you're in catastrophic coverage. And again, these are people that are paying $3,000, $4,000, $5,000 for their prescriptions. Most of us don't have to deal with this, but that goes away. And so there is no cost if you are in catastrophic coverage. All right, so these are good things, right? Now, the big thing that's happening this year is copays. Your out-of-pocket maximum cannot be over $2,000. All right, and that's good. Now, if you're like a lot of us, we only pay $20, $30, $40 a month, so we don't even get close to this. But people who have expensive cancer medications, or maybe it's for all kinds of different things that's advertised on TV, some of these things cost $3,000, $4,000. This is going to greatly help them because they're only going to be paying roughly $167, $68 a month, where in the past they would be paying $300 or $400. So this is good for them, but obviously someone has to pay for that. So when you're in catastrophic coverage in 2023, you had to pay 5%. And then the Part D plans right here paid the 15%, and then Medicare paid 80%. And then currently in 2024, the prescription drug plans have to pay 80%. And Medicare pays 20%, and Medicare pays 80%. All right, now look right here. Catastrophic coverage. The drug plans have tripled their exposure. They have to pay 60%, while Medicare only pays 20%. And this is one of the areas they said they were going to save a lot of money. And then the drug manufacturers have to pay the 20%. But bottom line, I'm not the smartest guy in the world, but I can tell premiums are going to do what? They're going to go up. You can't tell me that they're going to charge the same amount. So we've known this the whole year. We've talked to the drug companies and tried to communicate, this is going to be a problem. But the CMS and the administration, for some reason, just didn't seem to pay any attention to it. They said, everything's going to be fine. Don't you worry about that. You just go ahead. We're smart. You go do your job and just sell and be compliant. All right? So if we look at drug plan costs for 2025, these insurance companies have to submit all their proposals in July. All right? And now currently, the average cost for a prescription drug plan across the country is roughly $34 a month. Now, most of you aren't paying that much, if you're on the lower cost plans, but that's the average cost for 2024. So when the bids came in July, what do you think the average cost for the prescription plans would be? Drum roll, please. $143. $143. That's quadrupled what the current cost is, or the average cost. Well, this is not a good thing. So the administration and CMS, they go, well, this is a problem because we have told people we're going to save you money on your prescription drugs. Well, this is inflation at its finest. So they scrambled and got all together and said, we can't have this happen. We have an election coming up here very quickly. So what they did is they announced this on July the 31st. They've decided they're going to subsidize the insurance companies over the next 3 years in the amount of $7.2 billion. They're going to pay $7.2 billion. We tried to tell them, but they knew it. So what happens now is all these insurance companies have to do a new bid, and they have to get it back into them. And that everyone, if you don't participate this year, you're not going to be able to participate in the future. So we've been waiting anxiously, and today is September the 21st, and here is what I know today, and they could change. These are estimates. But these are the revised bids that came back. So Humana, their lowest cost plan is $43. SilverScript, they're only going to offer one plan. It's going to be roughly $45. Oh, and guess what? They're not going to be paying agents to help people enroll in this plan. Lovely. So if you're on that $9 SilverScript Saver plan, this is your new plan unless you do something. Okay. So we had hopes. United Healthcare, their lowest plan is $78, but they assured us they'd pay us commissions. Now, by the way, we don't make squat on it. We make basically $4 a month selling a prescription plan, and it's not worth the money. We do it as a service to our clients because it's very important. So it's not like we make a ton of money doing this. We lose money actually. And so, but the big question that I had is, what is WellCare going to do? Because I've sold a ton of these 50-cent WellCare plans, and they've been awesome. So we're wondering, what are they going to do? And lo and behold, boom! Somehow they're going to charge zero. Zero, nada, nothing. But they're not going to pay agents either. Now, they do have a $3 plan, and they're also going to have a $100 plan. But not only are they not going to pay us for helping you sign up for a plan, but all the business we sold them in the past years, they said, y'all don't need that. We're not going to pay you squat. Really? So we don't know what to do. This is crazy. But this is funny. These are press releases that came out. So this is for immediate release. This is on August the 15th. This is from Health and Human Services Press Office. Negotiating for lower drug prices works, saves billions. The Biden-Harris administration delivers on its promise to lower prescription drug costs for Americans. Really? Now, that same day, Biden-Harris price-setting scheme raises cost on seniors. Which bottle are you drinking out of? So it's very tumultuous, and there's a lot of anger and anxiety about this, especially for the insurance agents. But we are going to try to help everybody work through this thing. So the other question that people have, will this affect my Medicare Advantage plan? The answer is absolutely it will. And the reason it will is because your Advantage plan has a prescription drug plan. Okay? And the government didn't give the Advantage plan any money to subsidize their prescription drug plan. So what's going to happen? Well, you're going to end up with reduced benefits. And it's not just your company. All of them are doing it. So most of the plans would have a prescription drug plan that doesn't have a deductible. Well, guess what? They're all going to have one this year. So if you're on something like Eliquis, you've been used to paying $47 a month. Guess what? You're going to have to pay a deductible of $300, $400, $500, and then you go to your copay. So it will affect you as well. And again, it's not your plan. It's just everybody's having to do it. Plus, there's a lot of plans that are going away, being replaced. So you've got to pay attention, or you could end up without a plan. Now, we're going to be actively communicating with you. We're going to have a strategy for all of our Advantage plan clients. So don't worry. We're here. We're going to help you. All right. Now, what you want to do now is read and look for your annual notice of change that you should be getting in the mail. Now, I think SilverScript has sent theirs out. I believe Humana has, but I don't know about everybody else. And again, we're so late in the game, we don't know what's going on. Now, what the annual enrollment period, again, is going to start October 15th, goes through December 7th. And that's when you can change your drug plan. I recommend everybody shop that on Medicare.gov. We'll tell you more how to do that later in another video. Change your Medicare Advantage plan. We'll be doing a lot of that this year because of the disruption that's going on. Now, the annual enrollment had nothing to do with your Medicare supplement plan or your Medigap plan. Those just keep on going. Now, if you do need help with that, if you want to shop that out, we're going to be actively involved. I say we, me and my assistants, on Advantage plans and Medigap plans. But we're just going to stay away from the drug plans because there's way too much liability And the things that the Biden-Harris administration with CMS make us do, it's ridiculous to sell a prescription drug plan. We have to get a scope of appointment. We have to wait 48 hours before we call you back to talk to you about it. We have to record the phone call. We have to explain to you that we don't represent every company, and you should go to Medicare.gov to find it. And then if we do sell you a plan that somebody has to pay us commissions on, we have to read the entire summary of benefits out loud to you and make sure you understand that. That process takes at least an hour. It's just crazy. So this is not a good environment to be selling prescription drug plans. So I'm passing on that this year. Again, I'm going to help you, but I'm not directly selling any prescription drug plans. All right. So there's a good looking man with no hair. Sorry I didn't shave for this video, but I needed to get it out. Now, I will send you out more information once I know more, say mid-October. We'll be doing some trainings on shopping on Medicare.gov and make sure that you're not going to be paying more than you need to on your prescription drugs. I could care less about my $4. It's more important that you save $40 or $50 a month than my little $4 commission. So we appreciate you. We value you as a client. We're just trying to do what's right in a very difficult enrollment period, and hopefully everything works out fine. So, all right, have a blessed day, and I will talk to y'all soon when I know more. Take care.